So today we're going to be doing a E-stem treatment, interferential or IFC, and premod. First thing you want to do is obtain the right equipment. We have the ultrasound machine or stem machine here, towels for draping, and the electrode pads. Second thing you do during this treatment is go over to the machine. You want to make sure that it's off, no one's using it. You want to check the machine for abnormalities, any cracks in the glasses, or any wires sticking out of the machine, as well as looking at the outlet, making sure the plug is fully plugged in and no wires are frayed down there. The second thing I would do is verify the presence of contraindications for the treated area. Today we're going to be doing a stem on the VMO. I would look to see if there's any bruising, scarring, any new wounds, anything like that. And if I had a female patient, an older patient, I would ask them if they were pregnant. That would also be a contraindication in doing stem. And I would ask the patient if they had any previous E-stem treatments before, if they have any questions about it, if they need to know what's going to happen, or if they've already experienced it before. The third thing I would do for the patient is make sure that they are in a comfortable position. For a VMO, this would be a comfortable position for this particular person, sitting up against the wall, just having their legs spread out in a relaxed position. I would check light touch perception of the area, make sure that the treatment area is uncovered, nothing's blocking the E-stem from working, the E-stem pads from working. I would check light touch, make sure they're able to feel that. I would check capillary refill, just pushing down and making sure that their skin, when it turns white, comes back to the original color. For this area, I would check, I could check two places for pulse. I could check the popliteal artery back here, and I could check the like the dorsal pedial artery down here for pulse and make sure that they have any abnormalities there. Going on from this, I would turn the machine on. Just push it back against the wall. And to start, we're going to start with premod. So we will need 2 pads because IFC requires 4. So going in the machine, I would look into electrotherapy, and as you can see, there are all the different E-stem modules in here. So the first one we're going to do is premodule. We're going to edit the time. We'll just, for this sake, I can show you that you can edit the treatment time, but what we're going to do is just, we're going to set it on continuous. Gosh dang it. Okay, continuous. The treatment time, we'll say 10 minutes. The frequency high we'll put at 155, and the low we'll put at 85. Okay, so now because we're doing premod, I only need 2 pads. You don't want to check the adhesiveness of the pads, make sure that they're sticky enough so that they stick to the area. A big concern when doing male patients is that they have hair on their legs or any other area of their body, so it might not stick as well. So we want to make sure that these are adhesive, not necessarily new pads, but we want to make sure that they'll stick to the treatment area. So hooking up premod. And make sure that you only have 2. The first one I would hook up is the red one, and you want to make sure that area is the red electrode would be placed closer to the heart. Does that stick well?
Yeah.
Okay. And also when doing this, you want to make sure that the affected area, the treatment area, is free of any oil or anything like that that might not would put the adhesiveness into a compromised state. Alright, so now I would turn the intensity up, and I just ask the patient during this time if they feel anything, when they start to feel something. It should just feel like a tingling sensation. Do you feel that?
Not yet.
Not yet. I'll be able to feel until I get up to like 10.
There, now I can.
Okay. Okay, so we've got the treatment time at 10 minutes. We've got a cycle time continuous, so it's just going to keep going. And press start button to start the treatment. And during this, if the patient begins not to feel the stimulation from the treatment, you can always adjust the treatment intensity with the button here, so you can just get a screenshot of that. So, say he couldn't feel it at 12.5, we could adjust it to 14 where he could feel it more. Okay, that would be premod. So we'd stop the treatment. And during this time, as with interferential, you'd want to record the treatment parameters, make sure that you know what worked for them in the past to keep a record. That might help them in the future. And during the treatment time for both as well, you would look to see if there are any abnormalities during the treatment time, and as well as taking the pads off, you'd make sure that there are no like skin irritations or anything like that. And I would also ask the patient throughout the treatment how they're feeling, what they're feeling, if it's too much, too little, just to adjust it to their comfort. So from here, I would just go to start new treatment. Actually, I could just go home. Go back into electrotherapy. Because we just did premod, now we're going to do interferential. And this requires 4 pads. It's basically doing the same thing with these, connecting the red and black wires. And for interferential, you want to make sure that you create basically a treatment zone, most like an X. You want to make sure the black pads are across from the black pads and the red pads are across from the red pads. So this interferential could be used for a much larger treatment area than just a regular premod could be used. But it's essentially, just move that back down a little, keep it level. That's essentially the same thing. What you're doing with this is just creating a treatment area. So going back into this, I would go into edit. We could adjust the beat hot to, whoops, that's the intensity. It's not touchscreen. 155, and the beat low to 85. Adjust the treatment time to 15 minutes, and then adjust frequency. Feel anything?
Not yet. Yeah.
Oh.
Feel it.
Bring it back down. Is that good?
A little more.
Up?
Yeah.
There?
Yeah. I can
Okay.
feel that.
Alright, then we hit start treatment time. So as that's starting, again, if the patient feels through halfway through their treatment that they're not getting the sensation anymore, we can always adjust the treatment like so. You can adjust it to 9.6. So again, with this treatment, you'd want to make sure that you record the treatment parameters, make sure that you know what worked for them, if it did work for them, and you can always use that to review and adjust your treatment plan for this individual. Again, with this IFC, same thing as premod, you're going to want to make sure that there are no contraindications that are newly found. You want to make sure the skin's not irritated, they're not in pain, anything like that. I would ask them after the treatment how it felt, if they thought it was effective, or if we need to go more the next time. And I would ask them if they have any questions about the treatment for my last part. And that would be an IFC, interferential, and a premod treatment.